So welcome. We're going to start our session now on USAID Global Health, delivering analytics at scale. And my name is Altini Lirani. I'm the Senior Data Strategist with the Global Health Bureau at USAID in Washington. And for this presentation, I'm going to do it together with my colleague, Lisa Condos. And she's the Senior Data Scientist in our team in Washington, D.C., and she will come up on stage when her slides come up. So with that, I thought first we're going to introduce who we are as an organization within USAID. And the work that we're going to present today is not just Lisa and myself, but we are a team back in Washington, D.C. And in fact, half of the people in this room are our team. So if you look left and right, the person sitting next to you is a member of our team. So we had to bring half of the people here to fill up the big room here. But as the Global Health Bureau at USAID, our mission is to improve the humankind conditions to save life around the world. And USAID has done that for the last 50 plus years in the health sector. And our work is organized along three main areas, or three priority goals as we call them. The first one is controlling HIV/AIDS epidemic. The second one is preventing child and maternal deaths. And the third one is combating infectious diseases while at the same time building resilient and sustainable health institutions in our partner countries. So we have three priority goals, but the work that we're going to describe today in this presentation relates to the work of the second and the third priority, the preventing maternal and child death, as well as fighting infectious diseases. As probably many of you know, the HIV/AIDS has its own PEPFAR initiative, the presidential initiatives controlling HIV/AIDS, and they have one of the largest data operations just meeting the needs of the PEPFAR initiative. So the work that we're going to talk here will include all Global Health Bureau except for the PEPFAR HIV/AIDS related work. In terms of size of the program in the Global Health Bureau, we are the largest US government foreign assistance sector in terms of US dollar programs every year. Only our organization programs $3 billion in US dollar foreign assistance funds. The total USAID investments in global health, foreign assistance in global health are close to $5 billion. And if we include the PEPFAR, the HIV/AIDS targeting programs, then that goes all the way up to $9 billion in annual budgets. And as our key functions in the headquarters are actually supporting USAID missions overseas. USAID operates in 80 missions overseas. We have each priority has one of our priority has its own priority countries that where most of the programs are targeted. But we have offices in 80 countries and 1,000 health officers working in all those USAID foreign missions in partner countries. And most of our work is focused in sub-Saharan Africa and Asia, despite the fact that we do have programs in Latin America and Central Eastern Europe, and former Soviet Union countries, but most of the work is in sub-Saharan Africa and Asia. So with that, kind of like now, what we are going to talk today in this session. So we're going to discuss the USAID Global Health Analytics Initiative, the work that we've done in the last 3 years to build up the data analytics within the Bureau. We'll discuss as part of that initiative our data education program, which has been a focus of our work in the last couple of years, especially as we have taken up the implementation of a framework that builds on the Tableau blueprint that was announced this past year. Then we're going to talk about the impact of this work by discussing one of the leading use cases, business use cases for Tableau adoption and Tableau use in global health. And then finally, we're going to share some lessons and challenges that what we have learned in the last 3 years and plans for the future as we go forward. So our unit was established about 3 years ago, or 3.5 years ago. And As an organization, USAID and global health sector in particular is rich in data. Global health expenditures on data generation every year go into tens of millions of dollars. However, the problem was that this data were siloed within each health element. It was difficult for people to get access to the data that belong into one health element, for example, malaria or tuberculosis or maternal and child health. And there was also always an ongoing discussion about the best metrics to keep track of the program implementation in the field. And that impacted the quality of our reporting, the quality of the learning agenda of the sector, and so on. So with the vision of improving the quality and the access and the use of data, as well as the quality of the work that was being developed, the Data Analytics Hub in the Global Health Bureau was established. And we define our vision in a sentence like this one, that our goal is to empower the frontline technical staff in the headquarters as well as in the field missions to make data-driven decisions. And this was very intentionally defined, and it's kind of like speaks to our efforts to build a data culture in our organization that puts data in the hands of the frontline workers, whether it is in the field missions or in one of our 8 offices back in Washington, D.C. And it also speaks to the program, the way how we have designed the program in the last 3 years. Part of our work part of this work speaks to the fact that we adopted Tableau as a self-service analytics platform, because that is one of the core functions of Tableau, making analytics, data visualization easy for everybody. So that speaks directly to our mission of empowering our frontline technical staff. And then the other part of our data culture efforts that revolve around the data education program, the data literacy program, as well as maintaining the commitment of leadership to scaling up data analytics within the Global Health Bureau and the USAID field missions. So at the beginning, there was a lot of discussion in our organization about the structure of our unit, where this unit was going to be placed within the organization. In the headquarters, we are 8 offices. They vary in size, but we have offices that are 150 employees, and as a total, we are about 640 people in the headquarters alone. So each one of these offices has some of the leading technical staff in the world on issues of public health. So it was important for us to make sure that we develop and build a unit that would provide support across the Bureau to all offices. Now, I have adopted this chart here from a study that McKinsey did a couple of years ago. And here, what they describe here are the best practices in the field, in the industry, about when analytics center of excellence were established in an organization. And we call ourselves, we were organized in the model of an analytics center of excellence because we see our mission and ourselves as a strategic team of data scientists with a mandate to scale up analytics. So the primary function of our mandate is to enable analytics. And then we also do analytic projects and work with Tableau to develop Tableau dashboards and so on. But the primary function is to facilitate the scale up of analytics across the organization. And what you will see in this spectrum here is that it starts from a decentralized model to a totally decentralized model in terms of how the analytics units or centers of excellence are organized. In one side of the spectrum, you have completely decentralized analytics centers of excellence or analytics capacities, where they are distributed across all units within an organization. And on the other side, on the other extreme, you have one single data analytics service unit providing support to all the different offices within the organization. We are organized in the model of the shaded area there, where we have a core team of strategic thinkers to enable the adoption of analytics in the organization, but most of the analytics capacities, the ones that we support and enable, are based in our customer offices throughout the headquarters as well as in the field missions. So that's kind of like why what we call this one is the Federated Data Analytics Unit as a facilitator, enabler of analytics adoption across the organization. So we have worked over the last 3 years with Tableau's global services. They have been fantastic partners to us as we scaled up Tableau adoption and building capacity of analytics within the Global Health Bureau. And for the last year and a half, a little bit less than a year and a half, we have worked with them using the Tableau blueprint model. And it was only this spring when Tableau published this and called it the blueprint, but last year we were discussing this as the deployment framework for our data analytics program within the Global Health Bureau. And us being a business unit, we have representatives here from the MCIO, from the Office of the CIO at USAID. We do not deal with the architecture issues or with issues that relate to the deployment of the software, the Tableau server, and all those things. So essentially, as part of the Tableau blueprint, the areas of our focus are what we have up there on the screen now. So we have our bureau leadership as the sponsors of our initiative, and we'll talk a little bit later why maintaining the commitment of the leadership is important. If not, it's the most important factor in driving success of this kind of initiatives. We as a unit, we are the implementation team. We have our vision that I mentioned earlier, empowering frontline technical staff throughout the organization to make data-driven decisions. And the rest of our activities is organized along the lines of the Tableau blueprint areas that are included there. So these are all what this framework has helped us is that it has helped us to allocate our resources in a very strategic way. And it has also helped us to identify areas that we were not aware previously that we had to work on and to build capacity. For example, building our communications was something that we have put a lot of efforts in the last 12 months. But the first 2 years was not a priority for us, and we thought was not as important. Now we know it is important. We have worked to build our intranet websites and come up with a lot of other communication with a well-developed communication strategy in our opinion to maintain the commitment of our users, both in the headquarters as well as in the field missions. So with that, I think the Tableau blueprint has provided us really a well-tested framework, and we plan to continue to work this year in building on those areas that we have not invested as much in the past year or so. So with that, I think part of our efforts to build a data culture within the organization has been the deployment of Tableau as a self-service analytics, empowering frontline technical staff. The second part has been the development of a very robust data education program. And data education programs are important not just for USAID, but for all organizations. The chart that I have included here is borrowed from MIT Sloan Business Review, and every year they publish a study of analytics trends in the Fortune 500 organizations. And what I thought this was very relevant to the work that we're going to present today is the fact that you will see there in dark red is the percentage of employees that has access to data as reported by the Fortune 500 organizations. And you'll see that in the last 6-7 years, that percentage has increased. Organizations have made significant investments in billions of dollars to increase access to data, to organize their data warehouses, to make sure that everybody gets access to data. So they report that about 77% of their employees who need to have access to the data can access those data. But you'll see in the other color that only 49% of those employees can actually use the data that they can access. So there is a big gap between data access investments and data use, which refers to the capacities of the individuals to be able to, their knowledge of the platform, their knowledge of data visualization, data analytics skills, and so on. So this is not a unique problem only for USAID Global Health. This is a problem across the industry, and it is a core component of building the data culture in each organization. So our response to this problem was that we developed an in-house data education program. We started it about 3 years ago. Every year, the program has changed, has expanded to both to include more technical skills, but also to include knowledge relates to the policies of our organization, as well as the federal government policies regarding data management and data sharing and so on. So the first year we had the program with Tableau, with the support of the Tableau's global service. We had, through a competitive program throughout the organization, we selected 30 fellows, data fellows. They went through an in-person number of training classes that were targeted towards Tableau Desktop 1 and 2, visual analytics, and so on. And then following that, they worked with a mentor and coach for a period of 3 to 4 months to use the skills from training classes into their day-to-day work. So the role of the coach and the mentor was critical here because it made sure that they transitioned from learners to users of data analytics skills. And the second year, and then at the end of the program in the first year, everybody had spent a month or so to develop a capstone project that was approved by their supervisor or their division chief in our, as we call them within our organization. And what that meant is that everybody had a well-developed demo project where they had used their skills, but the project was also relevant to their work in the office that they work. So it was something that addressed an issue that their supervisor had asked. And people worked with different kind of questions, from questions that had to do with management issues, with keeping track of the budget flows within the USAID, to questions that that addressed epidemiological trends and disease burden in the countries where we work. The second year, we changed the program. We expanded from 2 instructor-led classes to actually 6 instructor-led classes. We expanded, in addition to classes offered by Tableau Global Services, Desktop 1 and 2, and Visual Analytics, and we also introduced Tableau Prep, and we have learned since then that Tableau Prep skills and data organization and data cleaning skills are very critical and very much on demand within our staff and the Tableau users in general. But we also introduced additional classes from other vendors, as well as classes, instructor-led classes that targeted issues of data management policies of USAID and federal government. The program, again, was followed by 3 months of coaching and mentoring, and then capstone projects at the end. So overall, I think this, for us, this requires significant investments. And in fact, the cost of the training cost per fellow, the data fellow that completed this program over a period of 6 to 7 months, is comparable to the cost of a 1-year master program in a public university. So and we do tell our fellows at the beginning of the year that you are selected through a competitive program to go through the data fellowship program. You will get these training classes, but please know that our organization is making a significant investment in you, and we expect that you will dedicate the time and the efforts to learn the skills and then apply those skills in your day-to-day work. So we have about 60 data fellows, global health data fellows who've successfully completed the program, and these are based in all offices in the headquarters. And this year we started a version of the program targeting the field missions overseas as well. We started with Asia region, and in the spring we're going to expand our data fellowship program targeting sub-Saharan Africa missions, USAID missions as well. In addition to the data fellows who go through the rigorous training program, coaching, mentoring, and the capstone, we also have ongoing classes related to Tableau skills, data analytics skills, data cleaning skills, and we've had in general over 270 staff who have attended those training on a regular basis, on almost every other month that we offer in Washington, D.C. And this means close to 1/3 of everybody who works in our headquarters has attended one of our data analytics training classes in the last 2 years. In addition to this, as part of our blueprint framework, we have also introduced we have built the Tableau users group for global health, and we also have introduced very successfully what we call the Tableau days. And Tableau days are are kind of like 1 to 2 hour long events where either a Tableau function is demonstrated to the rest of the group, new developments in the Tableau software are discussed, and it is also delivered via webinars to USAID staff in the field missions as well. And usually we get about 140 to 150 people from the headquarters and the field who sign up for each one of those webinars. So for us, I think that's a big part of our efforts to build a data culture within the organization, but it also helps us generate demand across the organization and the field missions for this line of work. However, our data education program is changing. This year we'll soon start the 3rd cohort of training program, and this year we're going to introduce some significant changes in the way how we going to deliver the data fellowship program. First, we are going to introduce e-learning for new Tableau users. And probably you all know that Tableau Global Services has, in the past year, introduced the e-learning licenses, their online learning platform for Tableau Fundamentals Desktop 1, Desktop 2, Desktop 3, as well as Tableau Prep. And this will be available for all new users, Tableau users, because we are in that situation where occasionally we get an email from an office director or another senior leader and says, I have my assistant and he needs to get a Tableau license. And Tableau licenses are not very cheap. We are a federal government. We are constantly working in a situation of restricted budget. So we cannot afford to distribute licenses $840 a year for anybody who wants. So we want to make sure that everybody goes through a training program before that person is assigned a Tableau license. And the e-learning platform, we hope this year will give us the platform to be able to build the skills of the new users. This year, we're going to prioritize in our training classes the data preparation, data cleaning skills. We'll start with Tableau Prep, but we'll also look to other technology and programs outside that can build the skills of our staff in preparing the data. And for the power users, those data fellows who've completed the program in the past years, and are working across the organization, the headquarters, this year we'll work with a group of about 15, 20 of them, so by March, April of 2020, they can take the Tableau certification exams and be certified. And this has also come as a direct request from the group of fellows who came to us and who see Tableau certification as a valuable asset for them in the job market, but also as a way for them to cement their credentials within USAID as well and in front of their supervisors that I've successfully completed the training, I have the skills, I can take more work, and I also have the official certification from Tableau. Another thing that we are introducing this year as part of our program is developing and delivering executive training data training for supervisors and managers. Here we are targeting mid-level supervisors, division chiefs, and managers, both in the headquarters and in the field missions. And our goal is to make sure that in the next 24 months, every single manager in the headquarters and in all 80 countries where we operate will sit through a day-long training on data analytics. And this, we hope, will make sure that they become educated consumers of the Tableau-related products and other analytics products, applications that their teams develop, but also will help us increase the demand for this kind of, for this line of work within the USAID field missions and the headquarters. And what I have here is a dashboard that is an example from the data fellows, the first cohort, which was about 2 years ago. And I like this one in particular because as USAID works, does not work on non-communicable diseases. Most of our work, our work is organized around those 3 goals that I mentioned at the priority goals that I mentioned at the beginning. HIV/AIDS, preventing maternal child death, and combating infectious diseases. But this fellow, she developed a dashboard using global cancer data, and she was trying to make a case that cervical cancer is a growing threat in the developing world. And this dashboard was a dashboard developed by a fellow, but it actually found its way in justifications that USAID sent over to Congress and at very high level within USAID to justify support for a new initiative that now targets cervical cancer in developing countries. And essentially it was maps like this which show that cervical cancer is primarily a developing country's disease in terms of the disease burden rates that had a very strong impact in successfully making the argument to Congress for the first time to support an initiative that was in non-communicable diseases. And with that, I think I'll invite my colleague here to talk about one of the best use cases in our bureau for how we use Tableau.
Thanks, Altine. Okay. So yeah, my name is Lisa Condas. I work with Altine in the Data Analytics Hub in the Global Health Bureau. And one of the stories we're going to tell you about is the impact that the Tableau program, the deployment of Tableau, has had on our bureau. And this is through our annual report. So before I tell you about our annual report, I'm just going to paint a picture. So all year long, across 70, 80 missions across the world, we collect information on the health programs that are being implemented at USAID. And around Christmas time, it's really poorly timed, around Christmas time is when the data call comes for that. And my face was associated with this data call. In 2012, my boss hands me this huge document and says, fix it. And I call my mom, I'm like, they think I'm a wizard. I don't know what this is. I don't know how to do it. It's overwhelming. I don't even know where to start. And so we spent a few years trying to figure out what our problems were and how to fix them. So this is what our annual report looks like in 2013. This is an actual slide. And it was this multiplied by around 120. And in January of every year, when people are coming back, reinvigorated, resolutions made that we will never sleep through a PowerPoint presentation again, we hit them with 120 of these. And then our senior leadership, almost always, tells us, so what? What is the message? What are we supposed to gain from 100? Like, people wouldn't come in, they called in sick when we knew they weren't sick. Like, what is the message? What are we supposed to do with 120 of these? And so the themes that came out of our annual report were some that you may resonate with. So our data are really complicated. There's so much data. How are we supposed to make sense of all this data? Where is the story? And what is an effective way of presenting data that does not necessarily involve 120 slides? And so the first thing we wanted to do is we wanted to reframe the issues. So the first thing is we have too much data. It's so complicated, we don't know how to make sense of it. And so one of the first things we did with Tableau is not even talk about the results, just show the data, show people the data. And so this is an actual dashboard that we built. The cells across the top are country aliases. So these are actual countries, these are actual results. All of our results are made public on results.gov, I believe is the website. And down, let me see if I can use this, down, I can't use it, fantastic. So down across our key performance indicators, KPIs. And these are actual real data. I've just aliased them out to protect the innocent. And so what this shows is basically at a snapshot how much data we have and how much data we don't have. That's all we want to talk about. We're not even talking about the quantitative results of the data. And one of the things we noticed is in 2016, these orange squares represent places where we actually don't have data. Someone told us they were going to give us data, and they never did. And so you can actually see at the very top, we had 54% of the data that we thought we had. And so we went from a whole paradigm shift of we have too much data to actually, no, we don't have enough data. And the gray areas show where we have no information at all. We have countries receiving funds, we know that they're doing programming, and we have no idea what they're doing. And so with just one visualization and just using a simple sort of heat map type approach, we showed people that the issue is not that we have too much data, we don't have enough of the right data. And so just by using this type of exercise, this is our 2018 data, and if you notice at the top, I wish I could use this thing effectively, but I cannot. It went from 54% results to 84% results in 2 years. And that was just by showing people We know you're doing things, we know that you're reporting on information, but we can't get insight from the data the way that it's coming in. We need everyone to get on the same page, we need the quality and the availability to be there so that we can all be in the same conversation about the data and the results that we do have. So that's one of the ways that we re-identified one of our issues, and we used Tableau to distill information into something that people could look at, not just a bunch of bar charts that showed where countries had data and where they didn't. The next thing that we wanted to do is not just show the data. So I don't know if you've ever had this experience, just blink if you have, but your boss comes to you and says, I just need a number, or just give me an executive summary, I just need to know how we're doing. Okay, don't bore me with the numbers and the details, just give me an answer. And so what we ended up doing is we created a set of dashboards for that audience, the audience that just wanted to know how many people have we reached this year, how many people received this intervention. And they just monitor those bands, those big numbers that tell us a nice story. But what we were noticing, for people like me who look at the details and the data, is that the relationships in the data didn't always make sense. So our numbers were either staying steady or going up, but the ways the numbers were going up weren't what people expected. So this is what's often called a butterfly chart or an angel chart. This is actually one of the people on Tableau Public, Bethany Lyons, I think, developed this chart. And what this chart is on the left-hand side, again, real data, you can find this online. Each of our countries' budgets is a bar, with the top countries at the very top and the bottom countries at the very bottom in terms of funding. So they're ranked in terms of funding on the left, and on the right-hand side, they are ranked in terms of results. And so sometimes there's this assumption that if a country has a very large portfolio, they must be the ones driving the results. And so we wanted to test that, and we wanted to show our leadership that just because the numbers are going up doesn't mean we understand why they're going up. So here are a set of countries that are actually ranked very low in terms of budgets, and I think one country is ranked 23rd or 24th, and it's in our top 5. So this is a very small country receiving very little funds, and they are the ones that are really driving the results. On the other hand, we have some of our top 5 countries in terms of funding that are ranked in the bottom 20s. And so if you were just to look at the overall results, if you were just to do this high-level analysis, these executive-type summaries, we would be doing really great. But we wouldn't have an opportunity to investigate why some of the top countries aren't performing as well as they were years ago, and why what some of the smaller countries are able to do with their budgets, where they could provide lessons learned that we could use in other countries. And so using Tableau helped us break the mold of these summary statistics. Just give me a number. Just give me a hands up, like thumbs up, thumbs down. It's more than that. And in order to engage our leadership, we had to make visualizations and apply analytics that they could respond to. And actually, after we showed this graph, one of our technical advisors, who is not a data person at all, went through each of our performance indicators and picked out her country and made a little portfolio for that country to show them, you guys are punching above your weight every single time. And so that was positive feedback for that country, who didn't even know we were looking at their data, didn't know how they ranked in terms of countries around them or countries in other parts of the world, to show them what you're collecting is meaningful to us. We are using it. And that's that disconnect that Altine was talking about before. There's a disconnect between collecting data and using it, but there's a consequence to doing that that isn't always articulated, is that data fatigue, that collection fatigue. I give you my data, and you don't do anything with it. I don't get any feedback. You don't tell me if it's good or bad or how it compares to others. And so part of the message that we wanted to demonstrate using Tableau and our data is that there's more to our data than meets the eye. And so one of the last things that Altine also spoke about was data culture. So a data culture is not just engaging people who like to look at data, like myself, more data scientists who just want to be in the data all the time and using new tools to interrogate it and to gain insight. It's about getting experts who aren't in the data realm to engage with the data, to feel like the data are theirs also, and make them actionable so that they can have conversations about the data, so that data become integrated in their business process, even if they don't see themselves as data people. So one of the things that Tableau has allowed us to do is leverage data from federated systems, from different data structures and types, and pull them together. So what is this chart? Again, real data. We have aliased everything out, but these are actual results from 2018. And the cells, the color block chart, are key performance indicators for a country across 3 years, 2016, 2017, 2018. Everything on the right-hand side, the pie chart, and everything below is their budget information. These are two systems in our government that do not speak to each other. They are completely different data structures. They have different data governance. Before, it was impossible to bring these two sources together until we had Tableau. And so what we were able to do is look across time and see that, for example, in this country, the reporting percentages in blue on key performance indicators were actually going up. They went up from 50% in 2016 to almost 100% in 2018. But toward the right, you can see in red that they started dropping indicators, that they said, we are not going to report on these metrics anymore. And so what we couldn't see before is that when we highlighted a part of their budget for maternal child health, which is about $40 million, they had no metrics. And so we had no way to describe their portfolio, their $40 million portfolio, with the metrics that we normally use. And so until we were able to put data in this type of format, we didn't know that. We didn't know that there was a disconnect between their results and their budget. And when we asked this country about it, they were actually using different metrics. They were using a different system that we didn't even know about. And so again, at the high level, we saw results, we saw good performance, but we didn't really know what was happening. Here's another country that has a similar profile. This is a different country, real country, I promise. And again, from 2016 to 2018, they went from 50% reporting to 100%. And you can see that the number of indicators dropped in red was reduced by half in 1 year. And what we can also see is that they have a very small budget, and they have a lot of metrics associated with that budget. And so what that mission is trying to tell us is that you gave us this much, and we wanted to do this much. And we are very aggressive in using our money to get our results. And these are the types of success stories that leadership pays attention to. And so it's shifting their focus from one number, one type of metric, to actually seeing success cases and cases where we can do better. So, Ati, I think it's you now.
So I will go over this last few slides very quickly, and we can open it up for discussions. And Lisa, you can come back up for those as well. So what are our lessons learned? And we have organized our lessons learned in two groups. One is about data culture, and the other one is about data education. With the first lesson learned for us is that leadership sponsorship drives data culture. And by background, I'm a social scientist, and I always like to remind my colleagues in global health that in social science, in constitutional design, which is one of my areas of specialization in the past, we always used to say that first you build the roof of a house, then the walls, and then the foundations. So the leadership sponsorship here is critical in the same way, because it is the first step that you start if you want to build the data culture. If the leadership support is not sustained throughout the period, then this will be not as effective as you would like that to be. The second one is empower frontline technical staff and managers. Do not build teams of data analysts in the headquarters or in specialized organizational units that work with the data. You want to build the data culture. Those who work with have to answer programmatic questions, policy questions, and evaluation questions on a day-to-day basis. They are the ones who need to have access to the data and have the skills to analyze and be able to read the data in an effective way. And the third one is enable storytelling with data. Just like what the examples that Lisa was describing earlier, being able to tell a story about the impact of your program or where you see a disconnect and use data to support the storytelling is critical. And it is more critical for us, we have found as a federal agency, because a lot of our reporting that goes to Congress and to other stakeholders as well as to public is always supported, is written in the context of storytelling. So having good data to support those reports is critical, and not use just anecdotes or other information as that we've seen used in some reports in the past. And the last one is we have matured and our program has increased in the last 3 years. The first 2 years of our health data analytics initiative, essentially it was kind of like a sandbox. Everybody was doing the type of designing the dashboards that they wanted to design, the color schemes and the charts that they thought works best. And that was fine because everybody was building skills, everybody was trying to develop applications. But as we build a sizable group of data analysts with the skills within the organization, and the number of applications increased, we noticed the need to standardize the way how we build the dashboards, as well as to standardize the data catalogs. And Lisa, for example, has worked with several USAID missions and helping them to develop the same kind of standardized dashboards that USAID field missions use for tracking the progress of their reports and for their quarterly reporting as well. So this is something that we became aware as our operation and initiative matured, and it is going to be one of our focal areas in the year to come as well. In terms of data education, our lessons learned are that first develop customized analytics training content linked to your data. And I know that this is a little bit controversial. Even this week, we met with several people here at the Tableau conference who had very strong opinions and said, never use your data to customize the training because people are going to focus on the data and not on the skill that you're trying to teach them. So they will say, I disagree with this number or with this indicator being the best one to measure under five child mortality and so on. But our experience has been that Tableau Global Services has been a fantastic partner to us. They've helped us with the delivery of all the desktop-related training classes. But at the end of each training, the global health staff and USAID staff come to us and say, I can't relate to all the training and the functionalities that were presented to me because I can't relate to Superstore data and to other data. So I don't know how to transfer or use those skills with my data on a day-to-day work. So part of our efforts this year is to customize some of the training classes with USAID Global Health or international development data. Another lesson for us is that capstone projects are key to impactful learning. In our case, people can sit through training for a week, and then it also can happen that they go on a temporary duty assignment overseas for 2 to 3 weeks, come back in Washington, D.C., the skills that they learned is gone. So the mentoring, the coaching, and in particular the capstone project is crucial in making sure that they continue to work to apply those skills in a project that relates to their day-to-day work. And it has also helped us a lot in maintaining the support of our leadership because at the end of each training data fellowship program, we have a big event at in our bureau where the leadership comes and they sit and go through all the projects that have been developed. It is a good experience for the fellows to see the support from the leadership, and this is also good for us to convince the leadership that the taxpayers' dollars are being used in a meaningful way and the learning is impactful. And finally, it is the executive data training for mid-level managers and supervisors. These are the people who interact with our data fellows on every day. They are the consumers of the Tableau applications that are developed. They are also the ones who generate demand for data analytics applications. So as I mentioned earlier, our goal starting this year is that within the next 24 months, we'll make it mandatory that and our leadership has supported this action, that every manager, division chief, supervisor will sit through an executive data education program so that we can build the skills of them and together with them in this way build a data culture throughout the USAID. So you have seen this chart. That this is it is used in literature in many places. Shows how innovations are scaled up and disseminated. And we often think about the impact of our work in scaling up analytics within our organization in the context of this chart. 3 years ago, when the Data Analytics Initiative started, there were a handful of Tableau users within Global Health Bureau. And they were doing their work, and kind of like some of them had bought Tableau license with their own funds and were using at home instead of having it installed at USAID computers. And through our data education program, we feel that we have reached we have transitioned from Tableau and data analytics tools being available to a small group of innovators to having a sizable group of early adopters. And the big challenge for us, why we are taking those steps for the next year with executive data training and with the changes in the data education program and so on, is so we can transition from having a sizable group of early adopters to having an early majority. So we can close the chasm there, as it is called, in terms of how innovations are scaled up or disseminate within the organization. And it is this actually what we think is going to be our biggest challenge, because this requires additional resources. It requires more support from the leadership and managers, and it does require the engagement of all mid-level managers to work with us every day to demand data applications for their projects and work. And with that, I think that's all our presentation for today. We'll remind you to fill the evaluations at the end of the session, but we have about 10 minutes if you have questions for Lisa and myself.